Hello and welcome to On Cue. I'm Eric Olson, KSMQ Public Television. Happy to be joined today by Dr. John O'Horo of Mayo Clinic, who is a critical care specialist and infectious disease specialist, researcher, to get an update on COVID-19 in our region, southeastern Minnesota, northeastern Iowa. Hi, Doctor. Welcome. Thank you for joining us.
Thank you for having me.
You bet. What is the update here? We are speaking on the 8th of April. What can you tell us about the status of COVID-19?
So nationwide, COVID-19 is climbing right now. And on the coast, it appears to be climbing quite dramatically. Here in the Midwest and in Minnesota and Iowa in particular, we seem to be lagging behind there by a couple of weeks, and our activity isn't quite as high as we're seeing in either of those regions. But we expect to see some more activity in the coming weeks. Some of the moves recently taken to increase social distancing, such as the shelter and stay-at-home orders, may delay that and flatten out that peak a little bit further. But right now, we're watching this very closely.
And we are seeing a few new cases. I know in our area, Freeborn County had a few new ones. I think they're up to 18. Mower County also, Olmsted. So they're climbing, but small numbers so far, but there may be a wave coming. At least I believe that's what the governor thought a few days ago.
That's what we're currently watching for, is to see that increase. There are definitely cases throughout southeastern Minnesota right now, and every reason to expect this will continue to climb somewhat further. Whether or not it will really peak as high as was being thought 2 weeks ago is hard to say right now, because some of those maneuvers that have been taken really seemed to have some impact on the curve that we've seen so far.
And I think just anecdotally, in my having to go out and shop or whatever, I guess it's about half and half of people I see with face coverings, with mouth, with guards, breathing guards on their faces. That is the recommendation now, right? When you're going into public places?
That is the recommendation from the CDC right now. This is coming from a recognition that patients who are asymptomatic, or rather pre-symptomatic, still may shed some virus. So spread is not just contained to people who are actively coughing and sneezing. So what's more important about having the masks on is this is helping to reinforce the social distancing. It's helping to reinforce things like not touching our face or to wash our hands before we do so, and helping us to maintain our distance between people, where we try to stay at least 6 feet away when you're not masked. So the masks are helpful in terms of containing the spread of this, but it's really an extension of all those other things.
We're speaking with Dr. Jack O'Horo, Mayo Clinic critical care specialist, about COVID-19 in our area. Doctor, one of your colleagues, Dr. Ritza, said today in a column that it's very important for folks, as the guidelines change, as people like yourself are learning more and more about COVID-19, these will change. But that's not to say that what we've been doing wasn't the correct thing to do, and that there are errors in this process. It's just fine-tuning what we already know.
Yes, that's correct. A lot of what we had initially recommended from both an infectious disease and even a public health perspective was informed from an abundance of caution when there were more unknowns about this illness. But the more that it spreads and the better we understand it, the more targeted we can make our recommendations. So we can start to scale back in some areas, but in other areas we may be reinforcing them. So the phrase I've been using a lot is saying this is a very fluid situation, and this is something where we do have to keep an eye on those things, knowing that we're understanding this just as along with everybody else as it unfolds.
And your one other colleague from Mayo, Dr. Khanna, talks about for folks to be vigilant about, yes, we know people are understanding about the terrible cough, but also there are gastrointestinal symptoms to be aware of.
Yes, there are. In the past couple of weeks in particular, two of the things that we have learned in this developing understanding of COVID is that gastrointestinal symptoms, mainly diarrhea, in some patients happens first before any of the coughing or respiratory illness. So that can be an early sign of COVID. The other one that was recently described is anosmia, or loss of smell, as a symptom that a small number of people have experienced, but seem to be their first symptom of COVID. So those are two symptoms that are now being added to our list of symptoms we're looking for when we're evaluating patients for COVID-19.
You're there in the clinic in Rochester, Dr. O'Horrell. How are you and your colleagues handling all this extra stress and maintaining some semblance of like self-care on your own? How are you holding up?
Our leadership has been very helpful in trying to make sure that we're paying good attention to self-care and coming up with a long-term schedule that allows us to rotate staff through so that we're not exhausting people before we really hit this point. And there's been a lot of preparation work going on, and as I said earlier, we aren't really at the peak of this by any stretch. So most of our work at this point is really in the readiness realm. And I'm fairly confident that we have achieved a high level of readiness, and that's being felt by a lot of our staff here, and it's very reassuring to feel that we have some plans in place to deal with this.
Good. Well, thank you very much for your time, doctor, and continue to stay healthy.
Thank you. You too.
You bet. Dr. John O'Horrell of Mayo Clinic joins us now, and that'll do it for this COVID-19 update. I'm Eric Olson.